Hello friends, welcome back to my YouTube channel. In this video, I am going to explain you the anti-asthmatic drugs classification, its mechanism of action and uses and adverse effect which comes under the Pharmacology 3, Unit 1. So in the 6th semester of pharmacy. So let us start our video with the definition of asthma. Asthma is nothing but it is a chronic inflammatory disorders of the airways, and this chronic inflammation causes the hyperresponsiveness in the airways that leads to the wheezing, breathlessness, chest tightness and cough. So for the treatment of the asthma, we use some medications. That medication prevent the asthma. So the drugs are known as anti-asthmatic drugs. So in this video, I am going to explain you the classification of the anti-asthmatic drugs with the tricks. You can remember easily. So first one is bronchodilators. In the bronchodilators, first one classification is beta 2 agonist. Beta 2 agonist further classified into short acting and long acting. For that, during the duration of action, we are going to classify it as a short acting drugs and long acting drugs. In the short acting drugs, first one is salbutamol, second one is terbutaline. You can remember it as TS, the transfer section. Like that only, you can remember the TS for the terbutaline and salbutamol. Next one is long acting drugs. Long acting drugs also, salbutamol also comes under the long acting drugs, and bambuterol and formoterol. So you can remember it as BFS. So BF means here not boyfriend. Breakfast I am considered as an example. So mother is asking her son that we want breakfast in this picture. So you can remember it as the son says yes. So here you can remember it as breakfast. You need breakfast? Yes. So like that you can easily remember this classification. I am giving you some easy tricks. So you can easily remember the beta 2 agonist drugs. So the next, the bronchodilators only, another one classification will be there, that is methylxanthines. You can remember it as a TUD. It is an Spanish animated cartoon. So you can remember it as TAD, theophylline, aminophylline, doxyphylline. You can remember it as TAD for the methylxanthines classification. So next one is anticholinergic drugs. So ipratropium and tiotropium. So here you can see that opium is common in the both drug. So opium you can remember for that, and the trick is IT. So IT companies you can remember it as. So next one is corticosteroids. In that two subclassification will be there, systematic and inhalation. For systematic you can remember it as pH scale. So pH, so prednisolone and hydrocortisone. So for the inhalation BF, here again breakfast you can remember it as. Next one is mast cell stabilizer. So ketotifen. So ketotifen you can remember it as keto group functional, tifen. So you can remember like that. Next one is sodium chromolycate. You can remember it as sodium and chrome, like, eat. So tenses like 8. So past and present tense, future tense like that, eat, ate. So like that you can remember for that 8, sodium chrome lykate. So next is sympathomimetic drugs, mechanism of action. So what is the mechanism of action of this sympathomimetic drugs in the beta 2 agonist? So here the beta 2 agonist binds with the beta 2 receptor, and there will be activation of adenyl cyclase, and there will be production of CAMP pathways. Here there will be activation of protein kinase, inhibition of the release of the calcium in the cytoplasm. There will be inhibition of the inflammatory cell functions, and it causes the bronchodilation. There will be smooth muscle relaxation also will be there. So next, the uses of the bronchodilators. The medication used to relax and open the airways, and it open or maintain the bronchial airways, and it is used to treat the several diseases syndromes, and chronic obstructive pulmonary diseases, COPD. So asthma, for the treatment of asthma we use the bronchodilators. So the pharmacokinetics of the bronchodilator is by the inhalation is most commonly used other than oral route. Here inhalation is used as the route of administration. The bioavailability will be 50%. Here the oral beta 2 agonist therapy is reserved for the patient who cannot correctly use the inhalation adjuvants. So who cannot use the inhalation process, that patient can use the oral beta 2 agonist. So now let us see the adverse effect of this bronchodilators. The adverse effect of the bronchodilators will be dizziness, nausea, hypokalemia, tremors. These are the adverse effect of bronchodilators.